Ever wondered how to save a life when veins are not accessible? Welcome to the world of intraosseous cannulation, a vital skill in emergency medicine. It's a technique for gaining access to the body's circulation when intravenous access is challenging or not possible. Intraosseous cannulation can be a lifesaver, enabling swift administration of medications and fluid resuscitation. Before starting the procedure, gather all the necessary equipment: an intraosseous needle, a stabilization device, alcohol swabs, and the right dressing materials. Always ensure patient consent and explain the procedure if the situation allows. Choose the insertion site based on the patient's age and anatomy, with common sites being the proximal tibia, distal tibia, and proximal humerus. Now here's the step-by-step guide to intraosseous cannulation. First, position the patient and expose the insertion site. Sterilize the area with an alcohol swab and let it dry. Hold the intraosseous needle at a right angle to the bone surface and apply firm, steady pressure while inserting. Advance the needle through the cortex into the medullary space, using a twisting motion if needed. Confirm proper placement by aspirating bone marrow or visualizing blood return. Secure the cannula in place with an appropriate stabilization device. Finally, connect the intraosseous line to the necessary fluids or medications. After the procedure, ensure proper dressing and stabilization of the cannula site. Monitor for signs of complications like extravasation, infection, or dislodgement. And lastly, communicate with the healthcare team about the successful placement and ongoing management of the intraosseous line. And there it is. You've successfully navigated the process of intraosseous cannulation. But remember, practice is key. Keep refining your skills through simulation training and real-world scenarios. And as always, adhere to your local regulations and guidelines when performing medical procedures, and seek appropriate training and supervision before attempting any new technique. Thank you for joining us today. If you found this video helpful, show some love by liking, sharing, and subscribing to our channel for more enlightening medical content. Stay tuned for more, and until next time, keep learning and keep saving lives.